My name is Anmol Madan. I'm a computer scientist by training. My background is in working with large amounts of data and understanding human behavior using machine learning. I got my PhD at the Media Lab at MIT. And since then, I started a company called Ginger.io, where I'm the co-founder and CEO. And we apply this understanding of human behavior specifically for healthcare applications for chronic patients. We're living in this really interesting time where people are walking around with these devices. There's about 5 billion of these on the planet. And your phone is this incredibly powerful diary of your life. It has location, calling, texting, accelerometers. You can tell when a person is unlocking their phone and staying up and checking their email. At the company that I co-founded, Ginger.io, we work with large amounts of data, millions of samples of data from these mobile phones about individuals, and we try to identify how they behave and which days are they likely to be symptomatic. So an example is when a person is depressed, they tend to isolate themselves. They become lethargic. They have a hard time going to school and going to work and doing the things that they normally do. Their sleep cycle gets disrupted. And we detect all of those sorts of behaviors using this person's phone, in the form of hundreds of features, hundreds of statistics that we can then capture periodically and predict which days they're likely to be symptomatic. At Ginger.io, we take that information, that intelligence, and then we drive interventions, which could be their nurse or their doctor reaching out and supporting the patient, or it could be their friend and family members intervening with the idea that you want to prevent emergency room visits, you want to prevent hospital readmissions, which are very expensive events. By preventing those things, you can give patients a better experience, and you can also save costs in the system.
So who is the customer of the company, and how does the people having smartphones, the users maybe of that application feel about being about being tracked, about the behavior and using all this data?
So Ginger.io today is deployed via hospital systems and payer providers, so insurance companies that have hospital systems associated with them in the US. The way it works is when you go to the nurse, your nurse says, hey, can you please get on to this system? You install the application on your phone, you start it once, it runs in the background, it builds a model of how you behave, and then your nurse can see on her dashboard which of her patients need help right now. And when that triggers, then the nurse can drive interventions or make a phone call or send messages through the app. It can be addressed in a variety of automated and manual intervention methods. So the users of Ginger.io are typically patients who have already been diagnosed or are at risk of these conditions. And this is a very big part of the market. So 20% of all patients make up 80% of the costs in the healthcare system. Most of those patients have comorbid mental health issues. And that's the kind of market segment that we're focused on. A big question or something that's really important when you're designing products of this sort of type, which is when you're using this digital exhaust that exists on not just phones, but in a variety of different sources like Facebook and Twitter, is thinking about privacy. And we have a strong stance on privacy. For us, the consumer really plays an important part in this puzzle. It's all about giving value to the consumer, to the user directly. The user needs to have control over this data. And so we use this information, but we never share any of the raw data with third parties. We obviously have to hash and anonymize and encrypt and do all the security pieces. We never analyze content of conversations or text messages. And then the only thing we share with your provider or with your friend or family member is an alert or a statistic with your permission. So you have to sign up and accept that's going to be shared. But ultimately, the core value is for patients who, frankly, are not getting the kind of support they need in the healthcare systems of the world. And we're creating a more efficient connection between an individual and their doctor so that you can scale up the limited medical and healthcare resources and can provide people better support faster.
How did you come up with that idea? Were you involved with the health sector, or how did you come up with it?
So Ginger.io originated out of the work I did for my PhD thesis at the MIT Media Lab. And my background has been in modeling human behavior using large amounts of data. I didn't have much of a healthcare background. I had collaborators who were epidemiologists and from the healthcare world. And we had some really strong results from this work that motivated me to start a company. And obviously, since we started the company, we do have several people on the team who have clinical backgrounds, as well as sort of healthcare, enterprise, and consulting backgrounds who know how the business of healthcare is run. I think one of the most important and interesting changes of our time is the sort of marriage between computer science and machine learning and these new kinds of algorithms being applied to the traditional problems in medicine and healthcare. And so we're at that intersection, and it's a really interesting perspective to have both of those represented in the same company.
So I understand this is the first company you are founding and managing, right?
Ginger.io is the furthest along of the companies I have founded. When I was in graduate school and prior to that, I always had a fascination for startups. I dabbled in startups. A couple of previous attempts won a few awards and things, but this is the first real company that's now 35 people and has raised venture financing and has deployed a platform with a number of institutional healthcare systems in the US. And so this is the first company to really break through that transition for me. So it's a very exciting experience when that happens.
So how is it day to day running a startup company in a really sensitive sector, let's say, healthcare? What are you learning through this journey, this experience?
There's a lot to learn by running a startup in the field of healthcare. And what's exciting is healthcare itself is changing. You can now measure things you couldn't measure before. I think I've mentioned this before, but 90% of the world's data was created in the last 2 years. And so with all of this information, you can really change how healthcare operates. I think the most exciting part of the company for me is seeing this vision that I had, which is a side project as part of my research, become a commercial platform that's now gradually deployed across the system. That's been really fulfilling. And my focus at the company is primarily on setting that product vision, working with our business teams to make sure we're thinking through how we commercialize it, how we price it, how we deploy it, working with our data and product teams to sort of really think about the kinds of predictions we can make and, the various directions and the disease areas where we can expand the same technology and potentially build even versions that we sell directly to consumers over time. So a lot of interesting things. The most exciting part of a startup at this stage is really the hiring piece. I think whoever is playing the founder, CEO role, that's probably the highest leverage role that they can play. So I spend about, I'd say, half of my time almost on hiring. And often it's convincing incredibly smart people to come and have coffee with us even before we start to make them offers. The kind of people you want to hire ideally already are very successful and have great jobs, and you're trying to convince them to leave their jobs and come work for your tiny startup. So that's a big part of my time. Another big part of my time is working on, as I was describing as the product market fit pieces, which is really understanding the product vision and making sure it fits into what we're selling and what we're pricing.
Have you had any hard times so far running a company? Any time that you thought I want to give up, or I cannot do it, or I cannot achieve this little goal I have for this quarter or whatever?
Every day in a company there is something crazy or hard times that are going on. There's never an easy week. There's always I think one of the things that doing a startup teaches you is when you live your life normally, your life has this sort of variance, right? So there's some things that happen that are good and there's some things that happen that are bad. When you live in a startup, your variance is like this, right? It's like, oh my God, we're going to be an incredibly successful company, and oh my God, we're going to die, and no, we're going to be successful, and it changes, and there's massive shifts. I mean, there's, sometimes you get featured, you win awards that you didn't think were possible. We had the chance to meet Larry and Sergey. And there's a video of Larry and Sergey talking about Ginger.io on YouTube, right? And it's a phenomenal experience and a phenomenal, satisfaction. We have days where, we find out we prevented a suicide at a big hospital system. That's incredibly motivating. You have days where, you miss a product deadline. You have a bug that is, causing havoc. You have issues where a customer doesn't sign on. Those are the bad days. And you have days where you've been working really hard for a hire and they come on board. You have days where you lose that hire. And so I think it's an emotional roller coaster. It's both an emotional roller coaster, but also an intellectual roller coaster. And if you like that intensity, if you like the, living at that scale, that speed, that sort of energy of things happening all the time and being surrounded by incredibly smart people who are as driven as you are, then I don't think there's any other replacement for it.